Hi, I'm Buckner.
And I'm Natalie Gaber, and we are talking about the impact of complementary therapy on PTSD symptoms. So our question is, in patients with post-traumatic stress disorder, how does complementary therapy compared to no complementary therapy influence patient reports of PTSD symptoms?
So, for a little background, PTSD itself can be defined as the complex somatic, cognitive, affective, and behavioral effects of psychological trauma. So, this can happen to anyone that experiences a life threatening or traumatic event, such as experiences in war, sexual assault, natural disasters, and many other traumatic events. So, with this disorder come along with many other symptoms. So this may include intrusive thoughts, nightmares, flashbacks of the past traumatic events, avoidance of reminders of the trauma, hypervigilance, and sleep disturbances. But these are not the only symptoms that a patient with this diagnosis might experience.
So, in looking at complementary therapy, we defined complementary therapy as the Western pharmacologic medicine that is used in addition to non-mainstream healthcare practices such as yoga, Pilates, meditation, other types of therapies that aren't pharmacologic therapies.
So during our research, we looked at several research studies that specifically focused on the effects of complementary therapy on the symptoms of PTSD and how those patients experience those symptoms. So one study we looked at was a study titled The Influence of Adjuvant Mindfulness-Based Cognitive Therapy on Symptoms of Post-Traumatic Stress Disorder. So this essentially looked at subjects in Iran that were male veterans, and they were currently taking pharmacological therapy, and their PTSD was related to war, and they had no other disorders. And so, with this level 2 randomized control study, it looked on the effects of mindfulness based cognitive therapy, which is the combination of mindfulness based stress reduction therapy as well as cognitive behavioral therapy. So, the control group just experienced group sessions and board games, kind of a social outing. And while the intervention group experienced mindfulness practices, group discussion, cognitive exercises, and discussed kind of home practices. And they met for 8 weeks, one time a week. And before and after their treatment, they took a post traumatic checklist analysis and a depression, anxiety, and stress scale, which kind of measured the severity of their PTSD symptoms. And so from this study, they discovered that amongst these middle-aged military vets with PTSD, they experienced a great decrease in their PTSD symptom severity, along with the depression, anxiety, and stress that they were experiencing as they went through this experiment. As well, we also looked at another research study with looking specifically at the prolonged exposure therapy and how it influenced social support on PTSD symptoms. So as well, this was a level 2 randomized control study, and this explored the impacts of exposure therapy and that impact on social support as well as the impact on experienced PTSD symptoms. So within this study, again, in the control group, they just met 10 times a week and just met as a group, while the intervention group met 10 times for 90 to 120-minute sessions where they, for prolonged exposure, they either saw images or went through virtual reality treatment. And before, in the middle, and after all of their treatment, they took the clinician administered PTSD scale, which kind of measured the severity of their symptoms as well. And this study as well also showed results with a positive correlation between prolonged exposure therapy and social support, as well as a severe reduction in PTSD symptoms.
So the third article we looked at was the effectiveness of cognitive behavioral therapy with respect to psychological symptoms and recovering autobiographical memory in patients suffering from post-traumatic stress disorder. So this study was looking at cognitive behavioral therapy, or CBT, which is a way to restructure thinking in PTSD patients. So there were 28 participants from Iran with a diagnosis of PTSD, and they had a control group which just took meds such as SSRIs, and then they had an intervention group which took group sessions from 60 to 90 minutes a week for 10 weeks with cognitive restructuring and behavioral modifications. And at the end of the 10 weeks, they took the self-rating scale of PTSD symptoms, and then also the experts who were a part of the group sessions took the scale for them as well. So they took that at the baseline and at 10 weeks. And comparing the baseline and the 10 weeks, they found that the CBT significantly reduced the PTSD symptoms in areas such as avoidance, intrusion, hyperarousal, and they also improved adult memory. And our fourth article that we looked at was effects of therapeutic horseback riding on PTSD in military veterans. So this was looking at 29 participants who were military veterans, and they were split up into a control group and an experimental group. So the control group, they were put on a wait list for 6 weeks, while the experimental group participated in therapeutic horseback riding for the 6 weeks. And this included an introduction to the barn, grooming, safety, and the lesson of horseback riding. And so during this, they took the PTSD checklist for veterans, as well as the coping self-efficacy scale at baseline at 3 weeks, so halfway through, and then at 6 weeks at the end. Both control and experimental group did this. So with that, they found that the implementation of therapeutic horseback riding lowered PTSD symptoms. It lowered them at 3 weeks, and then it lowered them even more at 6 weeks. So it showed a progression of improvement in PTSD symptoms over time.
So, in conclusion, after all of our research, we've come to conclude that the implementation of complementary therapy, in addition to pharmacologic treatment, will assist in the reduction of reported symptoms of PTSD.
Yeah, so we also say that we need additional research. It needs to be done in order to explore more expansive populations. Most of our studies were only done on veterans, and while this is mostly one small group, there are other individuals with PTSD that we'd like to explore the effect that this would have on them. And then also we'd like to explore other forms of complementary therapy. We only reviewed certain complementary therapies such as CBT and therapeutic horseback riding, but we are interested in exploring art therapy, massage therapy, yoga therapy, and different forms.
Yeah. And so, with all of this new knowledge, why is this important? And so, how does this apply to us as health professionals? So, as nurses and physicians and any healthcare workers, it's important and that we utilize these findings to encourage and provide resources for the patients that we care for that have PTSD, and encourage them to include complementary therapies within their treatment regimens, as research has shown that it will increase the overall quality of life.
And in this, we think that the usage of complementary therapy can be catered towards individuals with the vast majority or with the vast variety of complementary therapies that there are. So catering that towards the individual in order to individualize their treatment will help as well, such as the different forms of massage, recreational, yoga, art therapies.
Yeah, we think it's really important to cater these therapies to help benefit the patients in the best way possible and just increase their overall quality of life in the best way that we possibly can. Thanks for listening.
Thanks for listening.